Good morning, Bahamas. My name is Dr. Calais Philippe, and I'm the Senior Medical Officer in the Ministry of Health and the focal point for a climate-resilient health system. We're here today to inform the public about the Ministry of Health and Well-being, Climate Change, and Health collaborative projects with the Department of the Environment and Planning and Protection, the Ministry of Environment and Natural Resources, the Ministry of Social Services and Urban Development, the Department of Gender and Family Affairs, as well as with our regional partners, the Pan-American World Health Organization and the Caribbean Community Climate Change Center in Belize. Welcome. I will be your moderator for today. Climate change has been deemed the biggest global health threat of the 21st century. I believe it is one of the biggest threat and opportunities for the Bahamas to prove its opportunity to be resilient. Health is affected by the changing climate through direct impacts of heat waves, droughts, heavy storms, and sea level rise, and indirect impacts by vector-borne and airway diseases, food and water insecurity, undernutrition, and of course, forced displacement. Generally, people think that climate change only has to do with the environment, but it also impacts health. Let's start with understanding climate change. Climate change refers to the long-term shifts in temperatures and weather patterns. These shifts may be natural, such as through variations in the solar cycle due to the sun, but since the 1800s, human activities have been the main driver of climate change, primarily due to fossil fuels like coal, oil, and gas. Burning fossil fuels generates what we call greenhouse gas emissions that act like a blanket wrapped around the earth, trapping the sun's heat and raising the temperatures of the earth as well as its waters. Examples of greenhouse gas emissions that are causing climate change include carbon dioxide and methane. These come from using gasoline for driving a car or coal for heating a building in some countries, for example. Clearing land and forests can also release carbon dioxide. Landfills for garbage are a major source of methane emissions. Energy, industry, transport, buildings, agriculture, and land use are among the main emitters. As you can imagine, this is happening in the Bahamas as well. We've additionally seen extreme weather patterns from 2015 through to 2019 with Hurricane Dorian. That was very significant. The Ministry of Health, along with its partners, has recognized that we need to develop a climate-resilient health system. Why is health important? Well, health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And we have seen how such extreme disasters have impacted our health. Today with me, I have several experts who will be giving their input. We have from the EU CARIFORM Climate Change, Dr. William Hamilton, who will be sharing about his experience, as well as from the Ministry of Social Service, and of course, our very own from the Office of the CMO, the acting CMO, Dr. Philip Swan. Without further ado, I will introduce Dr. William Hamilton. We have been able to partner with the Pan-American Health Organization and the EU to qualify for the EU grant, as well as with the Green Climate Fund Readiness Proposal to qualify for the GCF Readiness Proposal. We'll talk more about them. Dr. Hamilton, I invite you to the podium.
Good morning, Bahamas, and thank you, Dr. Philippe, for the introduction. My name is Dr. William Hamilton, and I serve as one of 6 fellows for the region from the EU CARIFORM project, and the fellowship is centered around climate change and health. And I also serve as the first fellow for the Bahamas in the same project. What this project is all about is trying to build more leaders in the area of climate change And we have a intersectoral collaboration where all of the fellows involved are from different professions. And what this has allowed for us is to get perspectives on climate change from different viewpoints. As a healthcare provider here at the Ministry of Health, I have experienced climate change personally as a physician in Marsh Harbor during the passage of Hurricane Dorian, which is one of my main drivers for actually becoming more involved with this fellowship. The fellowship is a year-long program which is going to allow me to have some more experiences with SEDEMA, which is the Caribbean Disaster Emergency Management Agency. And I will also be doing a project and symposium around healthcare workers and their perceptions on how we prepare for disasters. Also, through this fellowship, I've had the opportunity for mentorship with Dr. Philippe, and thus far we have looked at a CAP analysis, which is a knowledge, attitudes, and practices survey for the general public on how they perceive climate change. And what we have done is we have looked at various vulnerable populations, which includes pregnant mothers, the migrant population, healthcare workers, and outdoor workers. Thank you.
Thank you again. Thank you, Dr. Hamilton. What Dr. Hamilton did not tell you was that he was able to qualify out of 86 candidates around the region to come down to 30 candidates, and the final 12 and the final 6 for the region. So this will be the first for the Bahamas to have a climate change and health fellow. The other component, there were other of those who were part of that application process, and we are in the process of developing a climate change and health leaders group. And if anyone's interested in joining us, please call us at 376-2396, 376-2396 in that regard. We're also working with the University of the West Indies School of Clinical Medicine and Research, along with Dr. Robin Roberts, to talk about changing the medical curriculum so that there are more physicians who are prepared for climate change in the future, as well as preparing a CME, clinical medical education, and clinical nursing education in this regard. We will be moving right along. I see one of our partners here from the Department of Environmental Planning and Protection. May I ask you to the podium to just share with us a little about the work that we've been doing? And that is in the person of Mr. Charles Hamilton. Thank you so much.
Okay. Thank you, and good morning, Bahamas. The Department of Environmental Planning and Protection serves as the focal point for the UN Climate Change Secretariat. We believe that it's absolutely vital that the issue of climate change and health is addressed as a country, and this is why we partnered with the Ministry of Health to support the implementation of these various climate change and health projects related to the Green Climate Fund and towards the EU CARIFORUM health project. For persons who don't realize, in terms of climate financing, being able to leverage opportunities in addressing climate change and health issues is a vital one. Less than 5% of all funding that is granted via climate finance facilities is granted towards health. When we know that there are significant co-benefits that can be achieved from leveraging climate change and health-related issues. For example, being able to develop climate-smart health facilities enables us to be able to meet our targets as a country in being able to reduce greenhouse gas emissions, while also providing quality health facilities that our people can be able to access care in a way that is affordable and accessible. Moreover, we know that diseases like Zika, chikungunya, even recent pandemics, they've been linked to our changing climate. And therefore, we thought it was absolutely vital to be able to close the gap between what we see as two separate agencies, because we cannot have a healthy climate without good health, and we cannot have good health without a healthy climate. This is why this has been advanced at the international level. We saw the Prime Minister speak about this as an important issue, and we see that the climate crisis combined with the COVID-19 pandemic has led to a double burden for countries like the Bahamas and other small island states. This is why we thought that it was a no-brainer. We must support, we must be able to enable these projects that are being implemented through the Ministry of Health in consultation with the Department of Environmental Planning and Protection and other agencies across the Bahamas to ensure that our people who are already burdened by the issue of climate change are able to get the support that they are needed. So I just want to say this on behalf of the Director of the Department of Environmental Planning and Protection, and most certainly our Minister and our Minister of State. We look forward to this continued collaboration and being able to drive for a healthy climate, because we know that the health of the nation is the wealth of the nation, and we gotta address this climate issue as soon as possible. So thank you for inviting us to this presentation, and I'm sure there will be more to be able to share with the people of the Bahamas. Thank you.
Thank you, Mr. Hamilton. Mr. Hamilton, along with the 5 Cs, would have been in the trenches with us during really COVID-19, writing the Green Climate Fund Readiness Proposal. We were able to submit that by November of 2020, and December of 2020, we got word that it had been approved. So we're really grateful for Mr. Hamilton and Dr. Kane of the 5 Cs for their diligence during that time, and Director Newbold for seeing the need. Our other partner, the Pan American Health Organization, is working with us because PAHO has a climate change and health program which aims to prepare health systems through early warning, better planning, and the implementation of prevention and adaptation. And we're working with PAHO to develop the first Health National Adaptation Plan. This will allow us to reduce the emissions of gases that cause climate change within the health sector and other sectors. And here are some key facts. Climate change is not only a problem for future generations, it's already happening. Higher mean temperatures are recorded each year, and more people are being affected by disasters, climate-sensitive diseases, and other health conditions. Climate change also exacerbates some existing health threats and creates new public health challenges, as Mr. Hamilton spoke about. Worldwide, only considering a few health indicators, additionally 250,000 deaths per year will occur in the next decade as a result of climate change. Thirdly, the health sector has an important role to play in reducing greenhouse gas emissions that are cause of climate change. Investments in greening healthcare facilities, such as the use of solar panels, energy-efficient equipment, and waste management must be made. Globally, only about 0.5% of multilateral climate finance has been attributed to health projects, and we hope to increase that in the Bahamas. Health facilities also need to be safe and remain operational during and soon after disasters. In the Americas, 67% of health facilities are located at risk of disasters. In the Bahamas, most of our facilities are near the coastline, and that makes a great impact. In the last decade, 24 million people were left without access to health care for many months because of damaged infrastructure. And we've seen that happen in the Bahamas as well. And the GCF project is going to be able to allow us to do that. We have today with us one of the consultants, Ms. Crossman Johnson, who is working to develop procedural manuals for climate-smart health shelters. We also have with us another one of our partners out of the Ministry of Social Services and Urban Development, the Disaster Management and Family Island Coordinator, in the presence of Miss Zenobia Coakley Mills. We ask her to the podium. Thank you.
Good morning, everyone. Good morning, everyone. Oh, sorry. I had a little mishap outside. That has me a little shaken. Okay, just give me a minute. Okay. I will stand on the protocol I'm assuming has already been established. I apologize for my tardiness, but I bring season's greetings from the Department of Social Services. I'm happy to be a part of history in the making as we move towards a greener consciousness. The Department of Social Services, the partner responsible for mass care and shelter in the greater framework of disaster preparedness, response, and management, appreciates the insight provided by this project. Let me publicly thank those facilities that lend to us the use of their buildings to meet the needs of citizens and residents of this country during times of crisis. The numbers of volunteers that man the shelters with the help of the Royal Bahamas Defense Force, the Royal Bahamas Police Force, medical team, and staff of the Department of Social Services who've been called on to assist with more regularity over the years as our disasters intensify. As we commenced our participation in this project, the reinspection of shelters with a new lens, some of the responses we received were, "But hurricane season over? But we did this already." So then came the explanation of the necessity to adapt a new way of looking and assessing and preparing as the planet responds to the abuse that has been inflicted on it. And as we, small island states, are most vulnerable, basically due to our small stature and positioning. Nevertheless, we were able to visit some 11 facilities in Grand Bahama, 7 in Abaco, and 6 in New Providence. I am sure that Ms. Crossman-Johnson has a greater appreciation for the challenge of developing a country that is an archipelago directly in a hurricane zone. We were very ambitious in our plans, but unfortunately, visits to some of the keys had to be deferred due to logistics. As we continue to devise our resilient response to climate change, it is important that a message is carried because everyone has to buy in to the need to change, the need to adapt, to increase our capacity to be resilient. Resilient people are aware of situations, their own personal reactions, and the behavior of those around them. By remaining aware, they can maintain control of a situation and think of new ways to tackle the problems. In many cases, resilient people emerge stronger after experiencing difficulties. Difficulties like Andrew, Francis and Jean, like Matthew, like the economic downturn, like Joaquin, like Dorian, like the coronavirus with all of its variants, and also wrapping our heads around the possibilities of tremors from earthquakes and tsunamis. As a people, resilience is who we are. It's just that we have to prepare. Thank you.
Thank you so much, Ms. Mills, and also want to acknowledge Ms. Andrea Newbold, who's been part of our team over the last week, traveling to Abaco and Grand Bahama and throughout New Providence, visiting the various shelters and making a new assessment of how to make them smart shelters. That's been very exciting experience. We thank Ms. Crossman-Johnson, who's our consultant all the way from Jamaica, to be part of this historic event. The Green Climate Fund has also been able to support additional consultants. We have our very own Ms. Joette Penn, who is a Bahamian consultant and part of the communications. We also have the anchor group who will be working on the surveillance and moving the surveillance system from paper-based to an electronic base, looking at the various vector-borne diseases and other diseases in association with the meteorological information to determine how we can develop an early warning system. We also have Dr. Yearwood, who will be looking at stock take and gap and the Ministry of Health's assessment as well. And we make a call out for a climate change and health consultant that we still need, and anybody who's interested in doing that, 376-2396. 376-2396. We are still building our climate resilient health team as we speak. Without further ado, I will bring on our acting Chief Medical Officer, Dr. Philip Swan. The climate change and health activities really began in the CMO's office. The first person was Dr. Merciana Moxie, who was the surveillance unit coordinator, and then she handed it over to myself. Currently, it also sits in the office of the permanent secretary, and under Secretary Dean, Sean Dean, has been strategic in moving this forward, and we want to acknowledge the work that she's done over the last year. Now we have Mr. Higgs, who's our PS, current PS, and Pernell King-Roll, and our previous ministers who saw this as very important to the Bahamas. We ask the Bahamas to participate with us, engage with us in climate change and health resiliency, because we will be coming to you to educate you more about climate change and health, but we're going to need you to be resilient along with us. Thank you. Dr. Swan.
Good morning. In an effort to coordinate the Caribbean region's response to climate change, the Developing a Climate Change Resilient Health System in the Bahamas project was developed. This project is designed to improve the climate resilience of the health systems in countries. The Developing a Climate Resilient Health System in the Bahamas project is a team effort between the Government of the Bahamas and the Caribbean Community Climate Change Center, the 5 Cs. The organizations in the Bahamas identified to execute the projects are the Ministry of Health and Wellness and the Ministry of the Environment and Natural Resources. This duet of ministries formed the National Designated Authority, the NDA. The Green Climate Fund is a primary source of funding for this project. As is common knowledge, and despite challenges more recently with responding to the COVID-19 pandemic, the Bahamas is still recovering from the devastation caused by Hurricane Dorian, which landed on our shore as a Category 5 hurricane on the 1st of September 2019. This terrible hurricane caused flooding and unprecedented destruction in Abaco and Grand Bahama. This was our worst climate-related experience yet. But later, in March 2020, the COVID-19 virus was diagnosed in country. This pandemic laid bare a number of deficiencies in the health system infrastructure, both from a technological and physical standpoint. It threatened our ability to continue to deliver routine health services to the Bahamian public. With the persisting waves of pandemic, the Bahamas, like many of our sister Caribbean countries, found ourselves having to prepare and mitigate against a potential hurricane landfall amid the COVID-19 pandemic. And as we revised our response patterns, guidelines for shelters, and other policies, several truths were evident. They were the urgent need to strengthen linkages and the need to build human, technical, physical, and policy capacity that will address climate change and health issues in the Bahamas. An early assessment of our facilities during that time and the whole process identified deficits in the following areas: climate change and health policy, climate change technical expertise, health workforce, community and civil society engagement, climate resilient health infrastructure, data collection, information and technology, and financing for climate change and health issues. This partnership, which is supported by the 5 Cs, and the work of the NDA, has been created to work toward strengthening our capacity to strategically respond to and close these aforementioned gaps. Specifically, this particular effort of enhancing climate resiliency through the Developing a Climate Resilient Health System project, that's a mouthful, in the Bahamas, will assist the Bahamas to strengthen our national organizations with human resources and technical knowledge to prepare, coordinate, and respond to climate change and health matters. The project calls for 2 main actions. The first action is to explore what is meant by and how the Bahamas will incorporate the idea of climate-smart health through the creation of policies and systems that promote climate-resilient health care. The second action is to enhance the effectiveness and alignment of surveillance systems that provide information on matters that impact the public's health. This includes the strengthening of communication mechanisms across governmental, private, and civil society agencies and building human capacity, as well as improving on technical and physical infrastructures to collectively and efficiently mitigate and respond to climate change effects. For a national health and environmental surveillance system to improve, there needs to be an assessment of existing systems against the ideal to identify gaps. It is anticipated that during this exercise, there will be a shift from paper-based to an electronic-based system that will improve the accuracy and efficiency of communications, data analysis, and responsiveness. It is further anticipated that this system, once implemented, will require significant human and technological capital. And further, it is recognized that first responders to climate disasters with health implications include healthcare professionals, environmental and health surveillance officers, and members of civil society. A national health and environmental surveillance system will permit the government not only to track climate change-related illnesses, but also predict and mitigate against patterns of health challenges associated with changes in the climate and the physical environment. A surveillance system would also facilitate the focused delivery of assistance and protective measures to vulnerable populations and families that can be impacted by climate emergencies, disasters, disaggregated by gender. Going forward, it is critical for the Bahamas to capture comprehensive and high-quality data. This data will be used to assess the impact of climate change and health interventions. It would also be used to determine the inefficiencies faced by vulnerable populations across the country. Ultimately, the data will assist partners and multiple governmental and non-governmental agencies to work on climate change issues. Additionally, climate change data will also streamline decision-making and support the development of appropriate interventions in the Bahamas. This would include an early warning system. These simple steps will contribute towards shaping the Ministry of Health and Wellness's strategic and resource mobilization plan. Training will also be provided to key officials who operate in the climate change and health sectors. As we plot the way forward in a post-COVID-19 world, with the unfortunate promise of increasing events caused by a worsening climate, the Bahamas must agree with and implement the next steps required to protect the citizens and residents of the Bahamas and fulfill our obligations under the Developing a Climate Resilient Health System in the Bahamas project. This includes, and these are the outputs of this project, an inception report and detailed work plan, a needs, technological, and infrastructural assessment of the current surveillance system, a human resources assessment using the knowledge, attitude, practice, and capacity assessment survey targeting key stakeholder groups, including a component on gender matters, public health surveillance system, training, workshops, and the final project report. The World Health Organization advises that climate change is the single biggest health threat facing humanity and health professionals worldwide. Health professionals are already responding to the health harms caused by unfolding crisis, and so are we. Global heating of 1.5 degrees centigrade is not considered safe. Consequently, a tenth of a degree of warming will take a serious toll on people's lives and health. Therefore, we must make sustained progress now to see the unique benefits that come with appreciating the effects of climate change and health. We wish this collaboration and the principles involved all the success as we rely on it to strengthen the Bahamas' response and work in the area of climate change and health. Thank you.
Thank you, Dr. Swan. As you've heard, the Bahamas, the Ministry of Health, along with its various partners, will be developing climate-smart health and all policy systems that are cross-cutting national policies, procedures, and practices. We will be able to enhance the national public health surveillance systems of healthcare facilities, hospitals, primary care clinics in the Ministry of Health. We will also be able to strengthen the coordinated mechanisms, communications across agencies, governmental, private sector, and civil society, and of course, build the human capacity to respond to climate change. We're grateful for our partners, grateful for the Pan American Health Organization, grateful for the consultants coming out of the EU project, which would have been Ms. Diane Roberts and Ms. Monique Knowles. We thank so much Mr. Xavier Knowles also was part of the project, and everyone in the Ministry of Health who supports this. And we look forward to you, the public, growing and learning with us about climate health and its resilience for the Bahamas so that we will be resilient together. Thank you so much. Now we'll move on to any questions from our media, starting with one. Ms. Tanya Cartwright from the Tribune.
Good morning, can you hear me?
Yes, we can hear you very well.
Okay, good stuff. My question is for Dr. Hamilton. The first Hamilton, I can't remember his first name. He made mention of workers, preparing them for disasters, etc. I just wanted him to elaborate a little more on that training for me, please.
Yes, thank you. Dr. Hamilton?
Yes, thank you so much for the question. So as it relates to preparing for not just hurricanes, but all hazards, it's important that we protect our human resources, which is our healthcare workers in this context. But in disasters, we have other professionals such as our security, Royal Bahamas Defense Force, police force. And preparation is a big topic. So as far as preparing our healthcare workers, one thing that we need to look at is not just ensuring that they have water, medication, but we need to also look at the psychosocial aspect that disasters will have. Because the psychosocial footprint from disasters is much greater than the physical trauma that they have. So rolling out things such as psychological first aid is something that we want to look a little closer at for our healthcare workers. Thank you.
Thank you, Dr. Hamilton. We move on next to Tyler Simonet from JCN. Please pose your question.
Good morning. Can you hear me?
Yes, we can.
My question could be addressed, I guess, to anybody from the Department of Environment, Protection, and Planning. We know that, I'm not sure if this initiative will address it, but we know that there has been an issue with the burning of fossil fuels when it comes to power plants. We know that some people have been able to see it, when they're flying over Nassau, they can just see billowing white smoke coming from these plants. Is there any, is this initiative going to address that in any way?
I'll have Mr. Hamilton and then respond as well.
Okay. Good morning, and thank you for your question. This project focuses on addressing climate change and health related issues. While we recognize as a department the importance for our country to be able to advance in terms of meeting its 2030 goals, in terms of meeting 30% renewable energies by the year 2030. This health project is only one of many other initiatives being done across the Bahamas so that we can be able to decrease our reliance on fossil fuels. What I think will be an important component of this particular project is in trying to develop climate smart health facilities. How do we ensure that our health facilities are able to also reflect that whole issue of reducing its reliance on fossil fuels? So seeing what is feasible and being able to provide power to our health facilities. And I don't want to preempt that because the work has to be conducted by the consultants. So I do believe through this project, we'll be able to see ways in which our health facilities can become more green and therefore reduce reliance on fossil fuels. And on a larger scope, the country is looking at ways to be able to increase our renewable energy spread. So I hope that that answers your question. And I know that Dr. Philippe, I think, wanted to chime in on that. Thank you.
The other component of this project we would have spoken about is the surveillance unit. And the surveillance unit in the Ministry of Health collects data daily and weekly. It's called a syndromic surveillance. And part of that information is about respiratory diseases. And so, as you can imagine, increasing fossil fuel burning has impacted people's respiratory health. And we will be able, through that project, to determine what has been the impact of people's respiratory health on the burning of fossil fuel, and can we make that link, and how can we really develop an early warning system in that area as well. So we thank you for that question. Did we answer your question?
Yes, you did. Thank you so much.
You're welcome. We're on to our news with Berthany McDermott.
Good morning. My question is, or I'm guessing someone from health, someone who may be able to answer. Is there a price tag associated with getting our healthcare system to a place where we need it to be in regards to being prepared for climate change and all the upgrades and transformations that we will have to make? Or an estimate, rather?
There is a price tag. We cannot give you that price tag currently because we have really just commenced these projects. The EU CareForum project commenced in July of this year. That's our Health National Adaptation Plan. We're working on the strategic plan. And then the GCF project more recently got started. Ms. Crossman-Johnson, who's looking at shelters, our Stocktake Gap, our Anchor Group, and all of those consultants will have to provide us with a costing. So what will it cost to have climate smart shelters? We don't know at the moment. What will it cost for our surveillance unit to go from paper to electronic early warning system? We don't know. So hopefully by the end of the project, we will be able to have an estimate. We do know that the EU CareForum project, which is an investment of 100,000, and the GCF project, which is an investment of 750,000 currently, is just the beginning. So these projects are just the beginning of the Ministry of Health and Wellbeing on the road to a climate resilient health system. Our next question coming from the Nassau Guardian, Ms. Rachel Scott, is that right?
Good morning, yes, that is right.
Thank you.
Question is line 9 products when we like them to be completed.
Can you repeat the question? Your connection is not strong, it seems like. Okay, while you sort that out, we will move on to Mr. Desmond Saunders from ZNS.
Yes, a pleasant good morning.
Good morning.
I see that there's the arduous undertaking very historic. And this is a huge task for you, getting major agencies involved. How is everything going to come together at the end of it all? And you talk about some of the projects that you have and your resiliency plan, which is very good and very historic for the Bahamas. But at the end of it all, what are those specific objectives at the end of the day that you wish to accomplish?
Great question. So how is it going to come together? Right now, what we're recognizing is building a climate resilient health system is not only about the healthcare infrastructure, the healthcare providers, but when you think about the system, it is from really across the institutions, because health does not reside in a health center. It doesn't reside in a hospital. Really, health is in the hands of the people. So we recognize that we need to take it from community engagement to all of the various agencies that have indirect impact on health. Water has indirect impact on health. Agriculture has indirect impact in terms of food security. And so in the EU Care Forum project, in developing the National Health Adaptation Plan, we have recommended a National Health Adaptation Working Group Committee that comprises literally all of the institutions in the Bahamas, so that we recognize how we impact health, right? So housing impacts health. The quality of housing is important. The quality of the transport system. So if you have a bus that is spewing forth gas whilst you're driving in your community, you're coughing when you roll up your windows, you're still gagging for clean air. So clean air, so the transport department is part of that. So this is a big undertaking. BPL is on our team as well. When we've sat down to speak with them, we recognize that each area has a climate project happening, and we need to synergize across not only our local institutions, but our international institutions. So we're just on the road of doing that. And so in the end, what's going to happen is health, transport, the environment, water and sewage, housing. We have to think of what is a resilient system in the Bahamas to ensure that our people are healthy and they have well-being in the wake of these disasters, and how does the health system, can it respond quickly? So the EU Care Forum project is a 5-year project, really, and we're just beginning with that. And so the GCF project, this readiness proposal, is for us to develop what they call concept notes, to then go back to the GCF to ask for more money for the implementation. So this is a long, good journey, and we've just begun. I hope that answers your question. Our news, digital, Christina Dragovich. Thank you so much.
Good morning. Thank you. My question is, there was mention made of assessing hurricane shelters and possibly converting some of them into smart shelters. Can we get an explanation of what that is, what's a smart shelter, and how may that impact some of our existing shelters?
Yes, we will. We'll have our consultant speak to the smart shelters. That's Ms. Crossman-Johnson. Thank you, Ms. Crossman-Johnson.
Okay, good morning. A smart shelter is a new concept, a brand new concept that came out of the Bahamas. And it is a concept that follows through on the smart healthcare facilities concept. So what happens, a smart shelter is one that is green, which means it's environmentally friendly, it is safe, which means it's resilient, and when individuals go there, they'll be really in a safe position. And it is maintained, which means it will be sustainable. So it works well before, it works well during, and it works well after a disaster. So that's what a smart shelter is. And in terms of the assessments that were done, we looked at the assessments that are currently done in country, and I must commend you on what has been done thus far in terms of having your shelters properly managed. But what we did is that we expanded it a bit to include the green component as well as some functional aspects of the management of shelters. So what we have done in terms of the assessments that we have done is that we looked at, as I said before, the green component, how environmentally friendly are the shelters that we already have in place, and what is required in order for us to have them becoming environmentally friendly and having a reduction in terms of their carbon footprints and in terms of their overall operational costs. What it is also that we need to have in place to ensure that these shelters function effectively in terms of saving lives, in terms of allowing persons to be comfortable while within these facilities, and having systems in place so that we can have a response system that is adequate, a response system that is very, very effective. Yes, that's it for now. Thank you.
Thank you so much, Ms. Crossman-Johnson. So the team was able to participate. That would have been our disaster manager in the person of Ms. Antoinette Cumberbatch. Dr. William Hamilton was on the team, myself as well, and so we were there on the ground making the check. Some of the questions were, does this shelter have a water storage tank? And is the roof collecting water? So that if the electricity would go down, would there be water? Are there enough bathrooms? Is there a shower? In terms of, is there solar panels on the shelter? So these were some of the areas in terms of making it climate resilient and smart. And as Ms. Crossman-Johnson would tell you, the Bahamas would be the first in defining what a smart shelter is and in developing a smart shelter. Again, I thank Mr. Hamilton, Charles Hamilton, and Mr. Kane for really inspiring this idea that really came out of smart health centers. Going to Eyewitness Digital, Mr. Royston Jones. Mr. Jones, okay. Going. He's. Mr. Royston Jones, calling Mr. Royston Jones.
Yes.
You're up to ask a question.
Excellent, thank you. So amid the pandemic, we're seeing, at least anecdotally, a massive surge of single-use plastics after we made some new orders.
So you're not coming in as clear. So.
Any better now? Any better now?
That's better.
Great, okay. So there appears to be a massive surge of single-use plastics amid the ongoing pandemic, sort of eroding the progress we had when we issued the single-use plastic ban. I'm curious if the Ministries of Environment and Health have observed how big this issue might be in the Bahamas and what they've been doing to address it with maybe the private sector. How bad is this?
Well, that's a question outside of the scope of this press conference. I can try and have it addressed for you. Mr. Hamilton, would you like to address this? Okay.
Thank you, Royston, for that question. we are aware that there are often unintended consequences in trying to address one issue that you can create a challenge in another area. I think that that's an important issue that's being brought up. We see that it's been brought up globally about the issue of single-use plastic uses throughout the pandemic. I think that you've seen where governments have encouraged, for persons to be able to reutilize sanitizer bottles, to be able to refill them, to be able to utilize cloth masks, et cetera, to try and reduce the amount of garbage that is produced from the medical facilities. That being said, this is certainly something that we need to look at. We'll take it back to the ministry and then see exactly how can we work in collaboration with our partners as we advance these climate change and health-related issues, because we know the pandemics will likely increase as a result of climate change. So thank you. We can put that in terms of our assessment to look at. Thank you.
Thank you. We would have mentioned about gender being a part of this climate change and health resilient and assessment. And as the director of the Department of Gender and Family Affairs, we are also committed to working with the Ministry of Health in this regard. Mr. Royston Jones, you have another question.
Thank you very much for that. There was a mention of landfills contributing, I think, to greenhouse gas. We also have two significant challenges in our country. One in the Family Islands with landfills and the way they're used, just placed on the surface without, well, some are buried, but most of them are just on the surface. And also the massive amount of debris created by Dorian and Abaco and Grand Bahama. I'm curious if there's any assessment of the extent or tonnage of debris coming from Abaco and Grand Bahama and what's being done about the landfills in the Family Islands, which are not as developed as the one here in New Providence, which is also contributing to this greenhouse problem and climate change.
That's a very good question, and addressing landfills directly is not part of this project, but we will most likely look into it in terms of how landfills and the respiratory impact of people who live near to landfills, if that's significant. Unless Yes, Mr. Hamilton is willing to address that question.
Okay, good morning again. While I do not wish to speak on behalf of another area, I know that within the forestry unit, there's been work and assessments being done around the issue in terms of debris that have occurred as a result of Hurricane Dorian. Additionally, the department is also conducting another project, a technology needs assessment project that is looking at how do we reduce greenhouse gases, so mitigate in the waste sector. That particular assessment has, that particular project has started as of July or August of this year, and we recently held a meeting of stakeholders within the waste and the forestry sectors to see how we can better work, taking into account the impact of Hurricane Dorian and addressing the issue of waste being produced from the Bahamas. How can we ensure that if another storm like Hurricane Dorian comes through again and our forest reserves are impacted, how do we reduce the amount of greenhouse gas emissions that are reduced? So I'll invite you all to reach out to the department so that as we advance this particular project, you can learn more about it. So I think that's all I have to say. Thank you.
Thank you again, Mr. Hamilton. So as you can see, there's some really exciting projects in climate change happening in the Bahamas. We're moving right up to Christina Dragovich for your next question, please.
Thank you. My next question is about healthcare facilities. There was mention made that a lot of our healthcare facilities are near the coastlines. Is this project also considering not just the upgrade or adapting these healthcare facilities, but also possibly relocating them due to climate change?
So this project, there are two, the EU and then the GCF. There's another project. May I ask Dr. Swan to speak about the infrastructure, about the health centers, and this question, please, Dr. Swan?
Good morning. Thank you for your question. So as Mr. Hamilton mentioned earlier, there's a number of projects that the Ministry of Health is working with various other government agencies and government on the whole in trying to identify how to improve the resilience of the health system, especially as it relates to responding and preserving responsiveness during disasters. So in specific to your question, if you're talking about resiliencies of our facilities and the Family Islands, especially or in New Providence, there is a project that is in its infancy stages that will review what is in place. We know that the ages of our facilities are 20 plus years. Without the proper maintenance over a number of years, we have had some challenges with their, in trying to add on to them, I guess you can say. So the structural integrity is being assessed, and the needs for improvement of the infrastructure, as well as aligning that with climate resilience, greenness of facilities is currently undertaken by the Ministry of Health and Wellness and our partners with the Ministry of Works. Thank you.
Thank you, Dr. Swan. So moving right along, Mr. Desmond Saunders, ZNAS.
Yes, the impact of Dorian has caused all of us to re-examine our building code. I want to find out any effort in terms of getting with the Department of Physical Planning and Town Planning to ensure resiliency of our structures. We've seen some of the damages in Abaco and Grand Bahama. Can you respond on that vein?
Well, I only can respond in the scope of this project, particularly addressing the shelters. When we were on the Keys in Abaco and in mainland and Grand Bahama, the Ministry of Works was a part of that team. They are consistently a part of the assessment of shelters with the Department of Social Service, the Royal Bahamas Police Force, Defense Force, Fire, anybody else, Miss NEMA, and of course NEMA. And so the Ministry of Works is part and parcel of the group and have made various recommendations in regards to the code, and we know that building codes will need to change, but that is in a different department. So we can only provide the recommendations moving forward to Department of Planning, but we do need them. They are part of the National Health Adaptation Working Group team, and so we'll provide their recommendation as well. All right, Ms. Rachel Scott. 3 persons. Mr.
Rachel is out, but she left. She WhatsApped me her question.
Sure.
Oh,
yes.
So she, on the initiatives that were listed, she's asking if there's a timeline as to when you expect to tackle them or roll them out.
Right. So these initiatives, the EU CAREFORM project began July 2021 and is scheduled to wrap up July 2022, of which we will have our first Health National Adaptation Plan and a vulnerability and assessment of at-risk populations such as pregnant women, the children, elderly, persons who have chronic diseases, immigrants and outdoor workers. And so that Health National Adaptation Plan will feed into the National Adaptation Plan that the Department of Environmental Planning and Protection is working on, which will need to then go to Cabinet for approval and costing of the plan. The Green Climate Fund readiness proposal, which was approved in December 2020, will go till December 2022, at which point we will have our procedural manual for climate smart shelters. We will have our stock take and gap assessment of the Ministry of Health, as well as training to implement a climate unit in the Ministry, climate and health unit in the Ministry of Health, as well as a strategic plan. The anchor group, which is addressing the surveillance unit, will have piloted a electronic system, an early warning system in 6 facilities in regards to looking at the syndromic information and how do we respond. And we will have a communication plan rolling out consistently, educating the public. We'll also have training of healthcare providers as well as the community to build resilience. We will have rolled out the medical curriculum for climate education for our community health during the community health term, as well as family medicine residents. There's many products that will come out. Also, Dr. Hamilton is working on looking at the need for mental health training, as he spoke about, for healthcare providers during this time. And many papers will be written and published firsthand out of the Bahamas, first time ever. Mr. McDermott, you have another question?
I do not, thank you.
Okay. Mr. Tyler Simonet, JCN.
Miss Tyler
Simonet. Madam, forgive me. Forgive me. Yeah. Tyler is a dual name.
That's all right. I don't have any further questions. Thank you.
Okay. And then Ms. Tanya Cartwright.
Hello, can you hear me?
Yes, we can. We can hear you.
Hi. Okay, good stuff. It's Smith Cartwright.
Miss Tanya Smith Cartwright, can you give us your question, please?
Thank you. Okay, you mentioned that PPL and the Ministry of Transport, et cetera, will be on board with your team.
Yes.
Just wanted to find out if futuristically, will there be emission testing from road traffic?
So I will turn that question over to Mr. Hamilton, because we are part of the National Climate Change Committee, which has all of these, most of them on it. And one of the co-benefits of looking at climate change and health is the recognition that we need better air quality coming out of our transport system. And I know that there was training for greenhouse gases and being able to measure that. Because health, remember now, health is at the end of the spectrum. We will determine if someone really, we screen, but also if they get sick. But this climate change and health collaboration is part of preventing further, health exacerbations. Mr. Hamilton, can you speak to that?
Okay. Thank you very much. While, again, I don't want to speak on behalf of another agency, we have been working with the Ministry of Transport as we've been compiling our national mitigation assessment to determine what can the Bahamas do to reduce its greenhouse gas. We have a report that will be completed next year to show where we are in terms of greenhouse gas emissions and what do we need to do to curb those emissions. And one of them would be in trying to improve the way how emissions are captured by agencies like the Ministry of Transport. I would say that this is at a recommendation stage. I am not aware of where they're at, but we do know that revamping our transportation system is something that we have highlighted as a priority for the country and for the government to advance in order to meet our 2030 targets. So look out for more information about that in the future. Thank you.
Thank you. All of the climate change, all of the climate projects that are really happening in the country also speak to our moving in terms of our sustainable development goals and are very significant. We ask the press to continue to really, journey with us and characterize, tell the story of what's happening in climate change and health in these projects, because they're going to be important to the country building resilience, but also the country being able to obtain additional financing. The more we do, the more projects that we're able to develop and report on, then we're able to specifically ask through the Green Climate Fund, the Global Environmental Fund, monies to support our small island developing state. Any other questions from the media? So we want to thank you again for joining us. Thank you for your commitment to educating the public. You will be seeing more from the Ministry of Health and Well-being, as well as from our other partners in this area. Stay tuned as we journey on the road to a climate-resilient health system with you. This has been your moderator, Dr. Calais Philippe, Senior Medical Officer, Focal Point for a Climate Resilient Health System and Director for the Department of Gender and Family Affairs.